On today's show, we're discussing a large and concerning measles outbreak in Bangladesh that the World Health Organization is warning about. I'm Jennifer Abbasi, director of JAMA Medical News. Staff writer Samantha Anderer is here to tell us about her story. Sammy, thanks for joining.
Thanks, Jen.
So what's been happening in Bangladesh?
Yeah, well, the WHO has reported over 19,000 suspected measles cases in the populous South Asian nation in just 1 month, from mid-March to mid-April. In total, about 50,000 suspected cases have been reported this year there, and there have been around 350 suspected measles-related deaths. Most of these infections are among young children, and the outbreak is affecting nearly every district in the country.
So what factors led to this outbreak?
So the surge in cases follows a recent decline in vaccine coverage. To put this in perspective, Bangladesh had previously made marked progress in measles control, pushing vaccination rates above 90% and drastically reducing cases over the past 2 decades. Then, in 2020, the COVID-19 pandemic disrupted routine immunizations. And in 2024, a government revolution led to a nationwide vaccine shortage. These events, combined with the absence of a supplementary measles immunization campaign since 2020, have left many children susceptible to measles, setting the stage for this massive outbreak. Experts told me the outbreak highlights that even in countries such as Bangladesh, with decades of progress increasing vaccination rates, temporary gaps may have outsized effects.
And we know that with the nature of measles, this outbreak poses a risk to other countries.
Yes, measles is incredibly contagious, and gaps in vaccination coverage can have ripple effects. Children and people who are malnourished are at increased risk of complications, including encephalitis and death in severe cases. The WHO has said that its Southeast Asia region is at high risk. Neighboring countries India and Myanmar face the most immediate threat. India has high vaccination rates, but has seen a rise in measles cases recently, and the country's large population and dense urban areas increase the likelihood of measles spreading. During a particularly large outbreak in 2023, measles cases in India rose to more than 65,000. In Myanmar, only about 70% of the population has received the first dose of the measles vaccine, and ongoing conflict limits surveillance and response capacities to outbreaks. Globally, the WHO has assessed the measles risk as moderate. Over the past few years, measles outbreaks have reemerged in countries that had previously eliminated the disease. For example, Canada lost its elimination status last year, the UK this January, and the US is seeing a sharp increase in cases and is at risk of losing its status as well. Last year, there were nearly 2,300 cases in the US, and this year it's already up to more than 1,800 as of this recording.
So how is Bangladesh responding to the outbreak, and what are some of the challenges in preventing measles moving forward?
In early April, the government ramped up vaccination efforts for children aged 6 months to 5 years. Since the campaign began, they've reached about 18 million children. But the WHO has said that continued dissemination is likely over the next few weeks, both within Bangladesh and beyond. In many high-income nations, immunization gaps are often due to vaccine hesitancy. In low- and middle-income countries like Bangladesh, the problem is more often due to access. International aid helps finance and coordinate vaccination campaigns, but experts I spoke with expressed concerns that cuts to programs such as the U.S. Agency for International Development puts future vaccination capabilities into question. They emphasize that having at least 95% coverage with both doses of the measles vaccine is needed to maintain herd immunity.
Thanks, Sammy. All right, if you'd like to learn more, we'll include a link to Sammy's story in the show description. This week, we also published a remembrance I wrote for Dr. Eugene Braunwald, a towering figure in medicine, who is considered the father of modern cardiology. Dr. Braunwald died on April 22nd at the age of 96. You can find that and all of our stories at jamamedicalnews.com. Thanks to Samantha Anderer for joining me. I'm Jennifer Abbasi. This episode was produced by Shelley Steffens and Sophia Kesa at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. Thanks for listening, and join us again next week.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.